So, what are you here for today?
So I've had a really sharp pain in my neck recently whenever I move it. I get dizzy a lot, I get fatigued, and I have like a really bad tremor I can't get rid of.
I think I might know what's going on, but we need to run some tests first, including a blood test and an MRI with contrast.
Okay.
My suspicions were correct. Your blood test showed specific biomarkers, and the contrast in your MRI highlighted lesions of your brain and your spinal cord. Given your risk factors of being between the ages of 15 and 60, a female of Northern European descent, and that you live in the northern U.S., my official diagnosis is multiple sclerosis, specifically relapsing remitting MS.
Okay, so what is that and what do I do about it?
So we actually have an educational video for our patients with recent diagnosis to help you understand more of what's going on.
Okay, great.
So, you've just been diagnosed with multiple sclerosis. This probably seems very scary and you must have a lot of questions, but we hope to ease your concerns and answer your questions in this educational video. We're going to start with how your nerve cells and nervous system should be working. I will start with a basic overview of normal neuron structure and function. Neurons are made up of a cell body or soma with a nucleus, an axon with an axon terminal, and dendrites, just to name the basics. In order for the neuron to efficiently transfer information from one nerve to another, myelin sheaths are wrapped around the axon to speed up this process. In the central nervous system, myelin is created by glial cells called oligodendrocytes. Myelin is essential for basic motor, sensory, and cognitive functions. Since you are here watching this video, that means that some part of your nervous system isn't functioning the way I just described. Multiple sclerosis primarily affects the physiology of neurons, leading to various symptoms you have been experiencing. MS is classified as a neurodegenerative autoimmune disease, meaning the immune system is attacked, leading to the destruction and degradation of neurons. The name multiple sclerosis comes from the scarring it causes on the neurons and the central nervous system, specifically on the myelin sheaths. Demyelination and inflammation of the neuron is the main result from MS, while transection of the axon can occur as well. Without myelin around the axon of a nerve cell, signals to the brain are disrupted. Myelin destruction is damaging to the nervous system and can cause several severe symptoms we will discuss later because, as previously stated, myelin sheaths are responsible for the speed at which nerve impulses can move. What most people may not know is that there are 4 types of multiple sclerosis. The first and most common type of MS is referred to as relapsing remitting, or RRMS. RRMS occurs in 85% of people with MS and can be characterized by periods of temporary symptoms called relapses. Another type is secondary progressive, or SPMS. This is when symptoms gradually worsen over time and sometimes with relapses. Most people diagnosed with RRMS transition to SPMS later on in life. A third type of MS is primary progressive, or PPMS. This occurs in about 10% of MS patients, and it is where symptoms get worse and worse from the start with no presence of relapse. The last and rarest form of MS is progressive relapsing, or PRMS. PRMS is only found in about 5% of people with MS, and it is defined by a worsening disease from the start with relapses but no recovery. There are some interesting risk factors that increase the likelihood of developing MS. First of all, MS most commonly affects those between the ages of 15 and 60. Females are twice as more likely than males to have MS. Caucasian people are of the highest risk, while Asians, Africans, and Native Americans have the lowest risk. A family history of MS obviously contributes to the likelihood of having the disease. Because MS is an autoimmune disease, certain viruses that cause infection have led to the development of MS. It is more common in temperate climates, and smokers are more likely than non-smokers to have relapse-remitting MS. The symptoms of multiple sclerosis depend on the person and the course of the disease over time. Symptoms depend on the location of the affected nerve fibers. Shown on the slides are common symptoms. These include numbness or weakness in limbs, electric shock sensations when moving neck, prolonged double vision, tingling or pain in certain body parts, and partial or complete loss of vision and movement is painful. Other symptoms that are less common include tremors or lack of coordination, slurred speech, fatigue, dizziness, and problems with bladder and bowel function. There are multiple tests that can help lead a doctor to a diagnosis of MS. However, no one test can confirm the presence of the disease, and it must be combined with another test result, symptoms, and/or risk factors. An MRI can show the presence of lesions of the brain and spinal cord that are caused by MS. The use of contrast dye during the exam will make these lesions visible. Blood tests can check for specific biomarkers associated with MS as well as rule out other diseases with similar symptoms. A lumbar puncture or spinal tap can show any abnormalities in the antibodies that deal with MS. Finally, evoked potential tests record electrical signals produced by your neurons and measure the speed at which information is processing to determine the state of the myelin sheath. The causes of multiple sclerosis are ultimately unknown. Multiple sclerosis is an autoimmune disease where the body's immune system begins attacking its own tissue. As stated earlier, this immune system malfunction causes destruction of the myelin. The myelin acts as a coating or insulation when it is damaged, there is no protection left and the nerve fiber is exposed. A combination of genetics and environmental factors are thought to be responsible for the ultimate nerve damage, as well as the slowing or blocking of messages along the neuron.
There are treatments for an MS attack which include corticosteroids and a plasma exchange. Corticosteroids are prescribed to reduce the nerve inflammation. A plasma exchange is when your plasma, which is a component of the blood, is removed and separated from the blood cells. The blood cells are then placed in a protein solution and put back inside the body. A plasma exchange is only used when the steroids do not work. General treatments for people with MS include physical therapy to teach patients stretching and strengthening exercises, as well as introduce patients to new tools and devices to make daily life easier. Muscle relaxers are also used when the patient experiences painful and uncontrollable muscle stiffness or spasms. Muscle relaxers help with these problems. Medications reduce the fatigue most patients experience. Other medications can always be prescribed for symptoms such as depression, pain, or bladder and bowel control problems.
Living with MS can be very manageable, especially when the following steps are taken. First of all, the right diet, including consumption of vitamin D to strengthen bones and biotin to help the breakdown of substances, can help with symptoms. Exercise and general physical activities will also help for more strength, better bowel function, and better cardiovascular function. Simple, everyday activities such as gardening or other household chores can substitute for organized exercise. If you start to notice extreme temperature sensitivity, staying in air-conditioned buildings, using ice packs, or moving to a different climate can help. Getting enough sleep and avoiding caffeine, alcohol, and nicotine is also essential to manage MS symptoms. Because infectious diseases can cause MS relapses, it is important to stay vaccinated. Vaccines including influenza, hepatitis B, varicella, and tetanus have been proven safe for MS patients. Emotional and spiritual well-being are crucial as well, so it is important to have a support system of family and friends to help you throughout your disease.
The multiple sclerosis community is widespread. The best way to connect with others who are going through the same things as you is to use the National Multiple Sclerosis Society website. They have multiple search engines to find a local or even online support groups to help you deal with your newfound diagnosis.
Research is currently being done to find better ways to treat symptoms as well as increase accuracy in diagnosis. Researchers are finding ways to stop the disease from progressing, restore the damage that was caused to the nervous system, and reduce the frequency of the disease. There are currently more than 1,700 studies and clinical trials taking place right now that are each optimistic in contributing to the management of MS. Okay, so do you have any questions?
No, I feel much better about my diagnosis. I'm definitely going to check out those support groups in the area.
Great.